Yeah.
So it's an ongoing challenge. We've seen a number of stories unfolding over the past few weeks. In Gauteng, just last week, we saw those protests unfolding. We saw several surgeries being interrupted. Just last night on the Modise network, we had Malegapuru Makgoba telling us that there are several life Isidimeni tragedies unfolding as we speak. It's incredibly worrying.
Just waiting to happen at any moment, and he stressed on this point, and even saying that if you look, for instance, in Gauteng, and saying that the highest number of complaints that his office have been receiving come from Gauteng. He's sitting with about 2,000 complaints. And let's just take a quick listen to what he has to say and unpack a bit what he means by this tragedy of life Isidimeni, which could potentially take place in one province quite specifically that he mentions, which is the Eastern Cape.
I've received close to 2,000 complaints. About 800 of those are from Gauteng. It just tells you, I think, the level of activity around complaints in Gauteng, in health alone. So it did stand out. But nevertheless, I think there are many life Isidimenis that are taking place throughout our country. I'm leaving next week to go to the Eastern Cape to look at a potential life Isidimeni somewhere in Fort Beaufort. I'm going to spend the whole week there. So there are a few of them. I think, as you know, there is the oncology problem in KZN.
Sure.
There is also an oncology problem that is being looked after now by the Human Rights Commission.
I mean, Aldrin, what is at the root of this problem? I mean, we can't, of course, identify one particular thing, but a number of sort of analysis pieces, people that look into the sector and monitor the sector as a job, as a full-time job, points to a leadership crisis in South Africa's healthcare sector. What can you tell us?
Well, certainly. Well, the first argument that's being made by the health practitioners, as well as those who have been appointed, the political appointees to these positions, of course the MECs, is that the argument that they're making is that it is very expensive to look after the frail as well as psychiatric patients. And remember that one of the decisions that was taken here in Gauteng, the reason to move some of these patients out of the life Isidimeni centers was because of the cost. And the MEC at the time said they were trying to curb the cost and it was too expensive. This is the same argument that's been made by the Eastern Cape government as well. And in the Eastern Cape, one of the NGOs, as well as I think Section 27, took the Eastern Cape government to court, saying that there's another life Isidimeni tragedy waiting to happen. And the High Court there in the Eastern Cape, I think it's the Port Elizabeth High Court, then said that we'll appoint a curator who will make sure that no patient is adversely affected by this move and trying to move the patients out. I spoke to the spokesperson of the Social Development Department in the Eastern Cape, and he's making the argument that it's costing the department 18,000 Rand per person, per patient, per month. Whereas with the other centres in the province, this is now just the two centres, the life Isidimeni centres in the Eastern Cape, where it's 18,000 Rand per patient. But with the other centres in the province, it's only costing 2,000 Rand. So what's happening there? So that's something that they want to be looking into, and that's the reason that they're trying to make sure that these patients are moved out so that the department saves money. I spoke to him about the Ombudsman, saying that he will be in the province, and they're saying that this is something that they will welcome because the province is actually looking at having its own frail centre that government is running instead of outsourcing it.
Yeah. Let's talk a bit about Aaron Motsoaledi, the health minister. Now, in the wake of the life Isidimeni tragedy, a number of people are pointing to him as the ultimate person who should bear the responsibility for the lives of those people who lost their lives. But in fact, what people might not know is that the provinces, particularly in the healthcare sector, the provinces hold all the power.
Yeah, and this is a problem that that Professor Makgoba has also pointed out, that you have the health minister being there, but the health minister is just a political appointee who sits at a national department, who overlooks policies in terms of policy implementation and so forth, but doesn't overlook the day-to-day running of various hospitals, of the various departments, the health departments across the province. And let's just take a quick listen to what he had to say about that.
And also created this situation where it disproportionately awarded the power of health in the province against the national minister. So people kept on saying, where was Dr. Motsoaledi? Dr. Motsoaledi could not be anywhere because the Constitution did not allow him. And when you looked at the National Health Act and look at the previous act of the apartheid era where the minister, the national minister had the power, those powers had been taken away in the new dispensation given to the provinces. And that's why in one of my questions to the MEC was, why was the minister not informed? And she was pointed to me and said, well, I did not need to inform him. This falls within my sphere of governance. And she was right, because that's what's in the Constitution. So one of my recommendations was that really the Constitution and the National Health Act should be re-looked at and give more powers to the national minister to prevent incidences such as this from happening.
So the Health Ombudsman there saying that in fact the Constitution needs to be re-looked at, and this is something that Anne Motsoaledi in fact wanted to approach the court with when the provinces weren't giving students those internships so they could qualify as doctors.
Yeah, and Aldrin Motsoaledi has also been stressing that he doesn't have enough power to intervene when you face a crisis like this, whether it is Mediosa, whether it is life esidimeni. He just has some sort of an, how can I put it, he overlooks in terms of what's happening, but doesn't have the power to make decisions in terms of what should be happening. And that's the reason why, in the case of these medical students who were not finding placements in the various provincial health departments, hospitals, he said that he wants to go to court and force these MECs, the health departments, to ensure that these, I think it was 1,400 medical students find placement as it is the constitutional obligations of the MECs. But if you look at other departments, for instance, if you look at the Basic Education Department, they face a similar issue where the Minister of Basic Education can't really intervene on the nitty-gritties of how the department is run. You find that the Gauteng department has a different, the Gauteng Education Department has a different system to the Limpopo department, and that's the reason why you end up with the Limpopo department having issues around the textbook scandals, where textbooks are not delivered in time because there's no synergy that comes from a national level. Or
the lack of proper sanitation in the education department.
Certainly, yes. And you have KZN, for instance, where in KwaZulu-Natal they've taken a decision that we will issue sanitary towels for free at various schools, especially schools where you have children coming from poor backgrounds. That's not a national policy. It is the KwaZulu-Natal's own provincial policy, and that's why they can do it, because the MEC does have the power to do it.
I mean, is there a reason why the power balance is constructed in this way, perhaps to not leave all of the power with national? Because after all, those who work in a particular province would be more well-versed about the challenges, the problems facing that particular province. So that, I suppose, is why national doesn't have all of the power. But what is the way forward here?
I think probably a relook at who gets the power in terms of the final decision-making. But I believe that probably what the drafters of our constitution were thinking at the time was that at a national level, you only have the minister there. And who resides at a national level? Nobody resides at the national level. Where you find the people are in provinces. So give the MEC more power. When I was speaking to the mayor of the city, the mayor of Joburg, Herman Mashaba, during their elective conference, he also made the issue, or the argument rather, that what he's finding very difficult running the city is that he feels that he's being a bit hamstrung, that you have certain projects that the city of Joburg would love to run. Unfortunately, they can't do that because they have to get the money from Treasury, or they have to get the money from the provincial department. And in terms of the politics of this country, as you know, especially in Gauteng, where you have the city of Joburg, which is being run by a DA-led coalition, but the provincial government being run by the ANC. And his argument was that he feels that there could be some political ploy in terms of trying to, I don't know, make it more difficult for the DA to run that municipality. And that's another reason that he's making the argument that there should be a change in terms of the legislation and the powers that, that he has as a mayor. And I guess if you make the argument around the various departments at a departmental level, whether it is the provincial Department of Health or the provincial Department of Basic Education, they would probably make the same argument. But then what happens when there's no due diligence? Whose neck must put on the block?
And who exercises that overall oversight? Who would do that?
Well, right now it is the minister, but who institutes a disciplinary, disciplinary action against an MEC, for instance? The system that we have right now, it is a political deployment system, where you find that the MEC is a political deployee, and probably you'd find that the HOD is not a political deployee. But the politics and the different political parties play quite a pivotal role in terms of making sure that the MEC, for instance, is held liable. If you look at the Life Esidimeni situation and what happened there, it was the ANC which had to step in as well and eventually force the MEC to resign, Katani Mahlangu to resign as the MEC of life. The MEC of health. But is that enough? What happens if you have a similar situation?
Her political party intervenes.
Exactly. Yeah. It must be her political party that had to intervene.
In her government position.
Exactly.
Right.
And that's the other thing. Should it really be her? How do we, as citizens in the province or citizens in the various cities, hold these MECs as well as the mayors and MMCs liable and accountable?
Some very important questions, some teething problems there we're having at this 24th year of our democracy. Well, thanks very much for coming into studio. eNCA's Aldrin Sampear, just talking us through some of the problems brought up by the Health Ombudsman, Malegapuru Makgoba.